This suffix is stomy, and I think I need to make on this sound spelling, let's make this an O. Not mark it out, but let's turn it, instead of the sound, let's make it O. Stomy, although it can be pronounced stummy. This is a surgical creation of an artificial opening. If you look at this picture, this is something that my mother has. She has a peg tube for enteral feeding, and she has a stoma in her stomach for that tube to move into her stomach. A feeding tube, basically. So the stoma is the opening. The stomy is the surgical procedure that creates the opening. The first word is ileostomy. Ileo. This is small intestine. You will learn that root a little bit later. And an ileostomy is a surgical opening that allows the final portion of the small intestine to come to the outside of the body. Ileostomy is done for patients who have bowel disorders who need a colostomy bag. So their bowels empty outside of the body into a bag that has to be changed. A tracheostomy. Trache is airway for our purposes here. I have seen patients in autopsy that have tracheostomies that have been treated. The one that comes to mind was treated at the scene of a car accident, a very severe car accident. A tracheostomy is a stoma that's created in the neck to allow a patient to breathe. If the airway is blocked or cut, if it's destroyed in some way, you have to be able to get air into the lungs. So a tracheostomy is done to facilitate that movement of air. The particular case I saw, one of the first responders or someone on the scene had improvised, they used the barrel of a ballpoint pen to open, to provide a tube for that air to go in. It was a desperate attempt to save the person's life, and unfortunately it did not work. But the patient came into an autopsy I was observing with that still in place. They tried with a tracheostomy. Again, the term is stomy or stummy, depending on how the word is structured.